Bring this meeting to order. Hopefully everybody's enjoyed today and the weather outside. And we're going to go ahead and get started with roll call.
Ms. Friedman?
I am here.
Mr. Arnold?
Here.
Ms. Banks? Ms. Bell? Here. Mr. Brown?
Here.
Ms. Carter? Ms. Clark? Reverend Gordon?
Here.
Ms. Harding? Here. Ms. Howe?
Here.
Ms. Mendoza-Locke? Here. Mr. Knowles? Mr. O'Connor?
Here.
Ms. Rodriguez? Dr. Russell?
Here.
Mr. Stengel? Major White? Here. Ms. White?
What the heck? I started to laugh.
Next, we have recognition
I
of
started to laugh.
visitors.
I saw that.
We'll start with you, Richard.
I'm a mess.
And a security risk.
Oh, Tracy Perry was center part. I was like,
Lane Tavansky, CJCC.
Juanita Helbig Sanchez, Board.
Paul Lewis, Recovery Counselor at St. Paul Community Center, Board of Trustees.
Dorothy Mockenstern, Good Grief of Northwest Ohio.
Elijah Jones, board staff.
Amy Kirkmeyer, Board Staff.
Cynthia Brown Sherry, Board Staff.
Faith Kelleher, Board Staff.
Pam Heinstein, Unison.
Michael Kelly, board staff.
Hi everyone, Carol Conlon with the Lucas County Guardianship Services Board.
Matt Melty, recovery.
And let's not let the moment pass where we don't reintroduce Senior Manager of Programs and Services, Elijah Jones.
nice to see you.
Nice to
again.
see you, Elijah. Welcome
Very
back. Thank you, Scott. Thank you very much. All right, well, thank you and welcome, everybody. We're glad that you're here. Next, we have the honor and pleasure of recommitting your oath to being back here on the board, Linda.
I have to swear again.
You have to swear.
Right. Judge?
I've seen that, Jack. Oh, thank you.
Step right over here, young lady.
Emphasize that,
I've known Linda Howe longer than probably either one of us. I talked to you. Fun business here.
Oh, you know what? If we're doing pictures, we have to shut the door. Shut that.
I just want to get one.
It would just look better.
It's a lot harder than it looks.
I can edit around it. I can put a logo behind them.
Oh, okay.
I mean,
Okay, great.
All right, Judge, we're good.
Sorry. We just wanted to
As many of you know, I've had the honor and privilege to administer the oath to a lot of the board members, and I appreciate your inviting me over here. And, you know, this is an all-star cast over here, and your return. I'm pretty proud. I get to appoint a number of boards, and I don't appoint anyone to this board, but I appoint a lot of boards. I'm pretty proud of some of the boards I appoint. As you may know, I appoint all the members of the Metro Park Board. I appoint different places, but this is an all-star cast you have here. This is a really good board. It's a really good board. And Linda coming back on adds to that.
Thank you.
If you'd please raise your right hand. I, Linda Howe,
I, Linda Howe,
do solemnly swear
do solemnly swear
that I will faithfully support the Constitution of the United States
that I will faithfully support the Constitution of the United States
and the Constitution of the State of Ohio,
and the Constitution of the State of Ohio,
and that I will perform my duties
and I will perform my duties
as a member of the Mental Health and Recovery Services Board
as a member of the Mental Health and Recovery Services Board
of Lucas County
of Lucas County
to the best of my ability.
to the best of my ability.
Congratulations.
Thank you.
Scott's going to have to do that. Wait a minute, we got to get Scott over here.
That's right.
I'm here to have you sign.
Okay, now you take care of this picture, remove all wrinkles.
I don't see any
Wrinkles.
Yeah.
Okay.
Sign that real quick.
Here it is.
We didn't do an initial, we just.
Got it. Thanks, sir. I'll give you a call.
That'd be good. Thank you. Thank you all.
Thank you.
Thank you, thank you, Your Honor. Judge. All right, while she's doing that, determination of items to be removed from the consent agenda.
Thank you.
Meeting notes from April 18th, Planning and Oversight Committee report, Treasurer's report for March fiscal year 2023, approval, for fiscal year 2024 allocations by agency, approval, fiscal year 2024 subsidy schedule, fiscal year 2024 administrative budget approval, and we're going to be adding the city ARPA funds acceptance and allocation, Ohio Moss Regional Mental Health Crisis Fund, Zeph Center Psychiatric Urgent Care allocation, Danny's Place Architect Engineering Development allocation, and the Health Officer designation. Do I have a motion to accept?
So moved.
Thank you. Thank you. You got it all for us?
Mr. Arnold,
I abstain.
Ms. Bell,
Oh, come back to her. She stepped out for a second.
Mr. Brown,
Yes.
Ms. Carter,
Yes.
Reverend Gordon,
Yes.
Ms. Harding,
Yes.
Ms. Howe,
Yes.
Ms. Mendoza-Locke,
Yes.
Mr. O'Connor,
Yes.
Dr. Russell,
Yes.
Major White,
Yes.
Is all set then?
Yeah, we still have a quorum with her out of the
Okay,
room, so
all
we're
right,
fine.
wonderful.
Okay.
If I could take everybody to pages 20 and 24 and 25, executive and nominating committee report. I'm sure everybody's read this, so I won't read it word for word unless you feel as though I should, Scott.
I don't think you really need to.
Okay, great, great. So I think first what I would like to do is say that the committee met and we've completed a slate, but before I begin discussing the slate, I would like to know if there are any nominations from the floor. Seeing none, I will move on to our slate. The Mental Health Recovery Service Board of Lucas County elects the following trustees to serve as Mental Health and Recovery Services Board officers for the term beginning July 1st, 2023, ending June 30th, 2025. Chair, Reverend Oris Gordon. Vice Chair, Nima Bell. Treasurer, Katina Harding. Secretary, Major Tricia White. And the Mental Health and Recovery Services Board of Lucas County elects the following trustees to serve as Planning and Oversight Committee officers for the term beginning July 1st, 2023, ending June 30th, 2025. Chair, David Arnold. Vice Chair, Christina Rodriguez.
Motion.
I need a motion at this point.
Second.
Thank you. Thank you. Roll call.
Mr. Arnold,
Aye.
Ms. Bell, Mr. Brown,
Yes.
Ms. Clark, or Ms. Carter,
Yes.
Reverend Gordon,
Yes.
Ms. Harding,
Yes.
Ms. Howe,
Yes.
Ms. Mendoza-Locke,
Yes.
Mr. O'Connor,
Yes.
Dr. Russell,
Yes.
Major White.
Yes.
Thank you. Now, Scott, it's on to you for our director's report.
Okay, thank you. I do want to make a couple of comments related to the last motion. With the changing of the officers, the committee appointments for executive and nominating who aren't mandated members will also terminate in June.
Okay.
So if anybody is interested in being reappointed, that isn't a mandated member, all the officers and committee chair and vice chair are mandated. If anybody else wants to serve, please drop an email over to me, and I will make sure that we get those appointments in our June meeting so that we can prepare for the months to come. I have a brief report. There's just a couple of things going on that I wanted to make you aware of. First, you see these lovely, can I borrow this? These lovely mental health crisis care helpline, care line swag bags today. All of you have one in front of you. There are a number of items related to the crisis text line and various giveaways that we do throughout the summer. We will hope that, and I think it's Cynthia's desire, because Cynthia, as you mentioned here, were introduced to her earlier, would like to get a picture of all of you wearing these fancy hats today for our social media accounts. So if that is something you would oblige us to do, maybe not quite now, but. So I'm going to tell you a little bit about those things. So these items are given to us by, we purchase those through a grant that we get through the Ohio Association of County Behavioral Health Authorities. They provide us $2,500 to promote the crisis text line annually. So we buy a number of these items, and throughout all of our community engagement activities, we pass all of those things out at all of the community meetings that we go to, while supply lasts. So I know there's a number of hats that are making their way through for the folks that are sitting in the audience over there. If we don't have enough out today, let us know and we'll go get some more. So as you know, the crisis text line is a free support line via text on mobile devices. An individual text for HOPE to 741-741 and will receive a reply by a trained crisis counselor 24/7, 365. The toolkits are a valuable piece of information throughout the state, because all the boards get these grants, and we all kind of promote the crisis text line differently. It's a great complement to the emotional support line that we also run, and of course the care line for emergency services. So it offers a full array of telephone and text services. And so we just wanted to clue you in on what our campaign is, and you can see the other stuff that's in there, along with a brief summary of the description of the crisis text line. So thank you for that. On the subject of crisis and suicide awareness, we are this week running a mental health first aid trainers. We have 16 new trainers going, or potentially new trainers, going through the week-long training. That is a big boost to our community. As you know, we have a number of suicide awareness campaign activities. The mental health first aid activity is one of our largest. And I think this is the first time we've run a training in several years. So it's actually a certification that's required. And several of our staff are mental health first aid trainers. I know Amy is one and several others. But we also invite community members and individuals with lived experience to be trainers, and we often partner somebody with lived experience and someone who's working in the system together so that the people who go through the training get the full experience. Classes can serve about 25, 26 people per time. It's usually a 8-hour course. It can be broken down into 2 4-hour blocks, and sometimes we even do several 2-hour blocks just to try and meet folks where they're at. We'll probably do with some of our community partners, I'll bet we do 30 to 40 of these a year. And so it's quite a few folks. And we try and, it's one of our main engagement tools right now, working with private sector. And so this is one of the tools. Question, persuade, refer is another tool, and that's kind of on the same line as the mental health first aid training. But these are all valuable tools. Our numbers on completed suicides continue to escalate. Adult males are Caucasians are the highest at risk, but we are seeing levels of increase with young people, and our health assessment that occurred several years ago showing an increased ideation in youth that we continue to address. And of course, we all know that the health assessment is being done right now, being updated, and we should see the results probably next year sometime. So these are all these little tools in the tool belt to try and address multiple issues. Speaking of multiple issues, tomorrow we will be coordinating a student wellness and safety meeting. We have about 40 people coming to a meeting at the Educational Services Center. 6 separate school districts are represented, as well as several major, some of the larger providers that are working in our local schools, to try and address not just student mental wellness, but also improve the safety of those who attend those schools and or work in those schools. So, that's code for reducing violence in schools. We have the Ohio Department of Mental Health and Addiction Services Chief of Prevention, Bobby Boyer, coming in to do a presentation on the Ohio Student Wellness Initiative, and we have Jordan Garza, who is this region's Department of Homeland Security's Prevention Coordinator, coming in and doing a presentation on school threat assessment. The idea is to build on a conversation that is occurring in many of the school districts regarding responses to student wellness and threat, and identify some opportunities to meet not just their needs, but the needs of the students, in relation to what treatment needs or mental wellness needs, and create a mechanism to potentially share information when it's appropriate. Because one of the things that we're hearing is if a student undergoes a threat assessment and is identified and needs services, if they stay in that school, there's a way of monitoring and supporting that child as they go through whatever services that they get. But if they transfer to another school district or an independent school, for instance, that information doesn't make it over to that next place. So, so that may mean that, you know, the school is not aware of the potential threat, or the person doesn't have the support mechanism that they once had. And so what we're interested in doing from the board level is just having a conversation about what we might be able to do to help support the conversation around how do we make sure that care coordination is appropriately delivered and information is transferred safely and appropriately, with you know, using the evidence-based practices that are there, and of course connecting our provider network into that discussion. Because Amy has done a lot of work with what's going on in schools, and of course we continue to have those discussions. And our providers, a lot of the folks that we fund, they're doing a tremendous amount of work in schools. I think we're in somewhere around 70 different schools right now. So there's a big footprint of our provider network doing services within schools, and not just Toledo Public Schools, but, you know, a lot of the other regional schools as well, and some of the privates. So we're well positioned to have that meeting. I don't know where it's going to end, but we have some ideas about potential funding options for some of these startup services, or, you know, it fits well within our ITP planning process as well, and how we manage data and use data. So we're really just looking at how do we contribute to this conversation. We don't want to own the conversation, but we certainly want to participate and contribute.
Scott, I have a question. When I was working in the schools, one of the issues when I worked in St. Luke's is that if there was a suicidal attempt and there was work done at the hospital, the parents would not release information to the schools. Is that being addressed?
We've not even had that conversation.
Okay, that's one of the things I think that maybe should be addressed, is because the parents would not let the hospital release that information. And even though we were at the hospital and we knew what was going on, we couldn't release the information to the school.
So I can tell you that the two hospital systems that we primarily work with have been invited. And at this point, I'm aware that at least one is going to be attending.
Okay, thank you.
So, you know, these are the kinds of conversations that we wanted to open up just by bringing people in the room, because this conversation has not been had yet locally with all the different players in the room. So we don't know where it's going to lend itself. We might be opening up a whole can of worms that we don't want no part of, but I think it's too valuable to just kind of let slip by the wayside here. So
Definitely worth exploring.
the meeting's going to happen tomorrow. Amy's going to run the meeting because I am heading to Columbus tomorrow afternoon to do testimony on Senate Bill 105. Senate Bill 105 is the revisions to ORC, Ohio Revised Code, Section 340. We are all somewhat familiar with Section 340. I'm not going to get into the details of that, but many of the issues that have brought our legal issues into play are addressed within Senate Bill 105, which is why I'm going down to testify. And it's been introduced in the Senate, and we will be testifying in front of the Community Revitalization Committee tomorrow at 3:30. So there'll be at least one other person from Lucas County. Our esteemed Commissioner, President of the Board, Commissioner Gerken, will be traveling with me to provide public testimony and support as well. So wanted to make you aware that that's going on. Give you a brief overview of what's happening in the budget. Of course, I've also provided budget testimony already once. So in the as introduced budget by the governor was very favorable to behavioral health services and had a substantial increase in most lines of behavioral health services. Unfortunately, when it came out of the House, we were not as fortunate. There's several lines that we're concerned about. The first is what we call the 421 line, and that is essentially where all of our discretionary funds come from from the state. The 421 line actually has a 6% increase in it. But the House included substantial earmarks within the 421 line. So that result is that Ohio Mass has less discretionary oversight on the amount of money that can actually be shared with the boards. It is right now, I believe, around $11 million less than what was available for boards last year. So it's a substantial reduction. We are working to get an amendment to the budget introduced in the Senate to return it to the as introduced. We believe that will be introduced probably, if not tomorrow, maybe Thursday, I think, because the budget is rapidly moving through. And if we don't get it introduced and it passes the Senate without any revisions, then it's essentially done. We got to get it introduced so that it can get into the conference committee and get negotiated out. Because if it doesn't get in the conference committee, they can't add anything in, they can only negotiate what was already in one of the two versions. So we've been working hard on that. And a lot of the legislative discussion around the budget, that was the first concern. The second concern is that the House version stripped out the amount of money necessary to increase, Linda, the state hospital beds, which has been one of Ms. Howe's major talking points over the last several years. That is our number 2 priority for our state association. And Ohio Mass's number 1 priority is to get that money back in the budget to increase state hospital beds across the state by at least 100 beds, which would put our 26-bed increase at Northwest Ohio Psychiatric Hospital back on the table. The third priority for us is the House version also stripped out the increase in residential state supplement funding for group homes. RSS is what we call it, and it provides $1,200 a month in subsidy to adult care facilities to house individuals in our system. The increase that was proposed by the governor was up to $1,600 per month. And all of that has been stripped back to the original proposal. So those are 3 big things that could impact our operations moving forward. 421, if we take a reduction, obviously we would have to rethink some of what our budgeting forecast would look like. We've already made some adjustments in the 120-day notice process, so we have some leeway there. And of course, we won't even know what that looks like for quite a while yet. I think it's fair to say that the adult care facilities, their expenses have went up, and they need some relief well beyond what we can even provide. So if we want them to do a quality work, we have to give them quality pay for that. And then, of course, state hospitalization beds, the 26 beds, while it only seems like 26 beds, it's a 20% increase in capacity at NOPH. So that's a big deal. So we'll continue to advocate. I'll continue to make sure you guys are aware of what's going on. There may be a time where I need to call on you to make a phone call or two to our state senators and representatives, and we'll let you, as well as those in the audience and viewing at home, know when it's time for that to occur. But I guess just for anybody who's thinking about it, keeping engaged and thinking about the engagement of what's going on in the state budget process, I mean, it's just really a fascinating process. Just when you think you're making a game, you get shot down, and and then it's vice versa. Sometimes you don't think you have any hope at all, and it goes the other direction. So,
What were they going to increase the beds? It says decrease money to increase beds.
say that again, please.
How many beds were you going to increase it to that they cut?
It was 26 beds at NOPH. I think it was a total of 100 across the state. So.
For how many counties are those 26
Well,
beds?
The 26 beds are 23 counties of the Northwest Ohio region. So, so there's that.
Oh, but another one. When I went down for the Latino, the Hispanic Heritage Day, I spoke with the head of the Senate Committee for the budget. We met afterwards on private session. There were several of us, and I brought up these points, but I didn't have specifics. And she said, email me. So I got it. Thank you.
By the time you get home, you'll have specifics. Along with the rest of you. I have a talking points for y'all.
Thank you.
So, yeah. We can
I
get
was
that
going to
to you.
ask, should we be emailing them at this point?
So it's always, in my opinion, just sending out generalized emails at this point in time isn't most effective. It really need to get to that group of people who are making that decision within the committee structure.
And that's
And so we tend to have a tendency to focus on the finance committee members.
right.
And I think, well, first of all, let me retrace that. Senator Gavarone is in leadership. She is always a good, she's a strong supporter of behavioral health, and she's always a good, it's always good to have that conversation with her. Senator Hicks Hudson, I do not believe is on the finance committee, but I don't know that for a fact. I did talk to her already about some of these things going on when I saw her last week down there.
Is Hoops on anything?
Say that again?
Hoops?
I believe so, but he's not in our region, but I know why you're asking. Let me get, because Hoops, Huffman, they're all, and Hoops I think is out of leadership now, but Huffman is clearly in leadership, and that's all the same region. So there's a lot going on there. I want to give people a quick update on One Ohio, since Matt's here. He's part of the regional, and I've been appointed to the state foundation board. You saw, if you were paying attention, the U.S. Supreme Court identified that they actually have to follow Ohio Public Meetings Law. Go figure, read the MOU. It's clearly defined in the MOU. Don't know why they weren't following it, but now they're following it, and that's good. They've allocated the first 2 years of funding, it looks like Lucas County is going to get about $2.8 million in the first 2 years for distribution. Now, that will be the biggest pot they get for the next 16 years. They have settled in on a grants management software, but it will take them 3 months to actually implement it, learn it, and then get, sorry, Linda, I should have said you're on the regional board as well, sorry. And get that information down to the regions so that the regions can let out RFPs so that they can figure out what to recommend back up to the One Ohio Foundation Board. Allsted, their timeline, I say they, but I guess it's my timeline, our timeline now. It doesn't look like money's gonna flow from there for the next 10 months, which, given they've been there a year already, I would imagine is gonna be quite the irritation to the, 19 regions that exist. They're gonna hire an executive director by the end of June. Well, the governor will appoint the person, but we'll have our 3 people selected and presented to the governor for that. And maybe when we have a full-time person in that position, things might increase a little more. But,
I'm sure they will.
you know, a lot of people are eager to see this money hit the communities. And I bring it up because we just had the settlement discussion for the other 6 last month, right? That, so we're on top of it. I know the regions are watching, and they're just sitting here waiting for something to happen. So the best advice to the regions are to get your work processes ready and start to develop your, whatever you think you want to collect in a grant application, because you'll have a standard one that comes out of the grants management software. You'll be able to add a few things into it to make it regionalized. But on the day it's announced, you want to get that stuff out into the community, because you think about what's going to happen. You have 19 different regions trying to allocate $54 million, and it's going to go through a skinny little bureaucratic pipeline where there's only about 3 staff members that can manage this process, and then it's got to hit a committee. So essentially, it's going to take a couple of months to get through that process. So you want to be first in line. You want your applications in first, so that if they decide to do first come, first serve, you're up and you're getting that money spent. So I'll keep you all involved in that conversation as well, because we all have a part in it. You know, our agencies that are funded, our community services, anybody that's been impacted by the opioid epidemic is essentially eligible for funding. Just as a reminder, I committed to when appointed to the foundation board, that we as a board would not seek opioid-related funding. But as an ex officio member of that board, we're certainly going to be able to have the conversations about who's getting funded, what's happening in our community, how does that commingle with the things that we're doing and other things that other associations or foundations are doing. So we're in the conversation. And so that's going strong. And I wanted to remind everybody that this Saturday, the NAMI Walk is happening, 10 o'clock. We have a team. You can go to NAMI Toledo's website and register and donate to the team. But there will be a few of us there for the walk. The location is at Secor, NAMI's office on Secor. And there's still time. And then mark your calendars, September 9th, Saturday, for our Recovery is Beautiful Festival. You know, that's a signature event of our community engagement. We hope you all can be there. We'll let you know the location, but the date is September 9th, and that's all I got for you.
Well, thank you, Scott. Open session, moving right along. Richard?
As we speak, City Council is meeting. They are accepting a HUD grant, an emergency solutions grant for $648,000. They will submit a plan to HUD as to how that's to be spent. And they also are allocating $61,000 to St. Paul's Community Center for their winter crisis program. It does explain the fact that this board has had a relationship with St. Paul's for many years to fund that. Great discussion this morning at County Commissioners. He was here a minute ago, but he left. Lenny Tomansky was now the Behavioral Health Criminal Justice Coordinator. Among the things he needs to do in his new position is do something about Court Diagnostic and Treatment Center. They have lost personnel. They have a backlog and they cannot do evaluations. And what that means is people sitting in jail for a much longer period of time. Doesn't do their mental health any good, and it doesn't do the taxpayers any good. So yes, something needs to be done about that, and the county commissioners were confident that they went on and on about his credentials, but it's very important that we take a look at timely evaluations for people in the criminal justice system. And I'm concerned that yesterday, President Biden, this is on what Scott was talking about, urging Congress to act on gun violence. It says that he will meet with state governors. And what he's going, I'm quoting here, he says he wants the federal government to have access to all records that could prevent a person under 21 from getting their hands on a gun. I don't like the sound of that at all. I think that might backfire. It might send a message to young people that if you're asking for help from an agency or from your school, that's going to go into some huge government database you don't know who has access to, you don't know if hackers can get into it, you don't know if potential employers can get into it and find out that you were once treated for mental health services. This is just one more reason that young people will not seek the help that they need. And I've always been of the belief that, remember, we've had school shootings on a regular basis since the 1990s. If you have talks about prevention, then you don't need to have talks about intervention at a later date. Every discussion today has to do with violence. Oh, we've had school shootings, let's do something. Well, we should have been doing something a long time ago. We should have been talking about prevention a long time, decades ago. But here we are. Every article that I read has to do with violence. There's nothing about prevention, there's only intervention. It's sending a message to young people. If you ask for help, don't be surprised if people treat you like you're a potential school shooter, even though you might not have any history of violence or anything. Don't be surprised if you're mistreated. It's just one more reason that young people might be reluctant to seek help. Thank you.
Thank you.
If I might add a little bit to the court diagnostic discussion, I meet routinely with Renee Palacios, who is the Executive Director of Court Diagnostic and Treatment Center. And tardy assessments for incompetent to stand trial or other reasons, forensic assessments, has been an issue. However, that issue is being addressed in many cases by the identification of new psychologists that are coming into our community to do that work, redistributing some of the workload. We've invested, as you are aware, several times in court diagnostic to help them build their infrastructure, and that is showing dividends. It is not all just about court diagnostic being able to do specific assessments. It takes two to tango in this case. And there has to be some collaboration and coordination across the criminal justice system in order for those assessments to occur timely. And there's room for improvement in all of those areas. Regionally, I believe that we'll be looking at some investments with some of the new ARPA funds that are coming to advance court diagnostic even more, to improve their ability to do assessments, but also build Medicaid so they can build additional capacity. But The end result is if those assessments aren't done timely, no matter whose fault it is, people languish in jail longer than they should, which means they're not getting the quality care that they need or the hospitalization that they should be getting. So that is something in our community that we are very concerned about.
Can I, in the last several months, we haven't had any this month, but the last couple that we've had did move quicker than they used to. And they had people doing assessments who maybe don't live in Ohio, they're able to do it virtually. And we were able to access them much quicker than before.
This board provided funding to Court Diagnostic to purchase 4 laptops and the infrastructure so that tele-assessments could occur in the jail. I'm hearing that there could be an improvement in the protocol being used so that so we could increase that accessibility even more. So that's the next conversation that'll be taking place.
Great. Anything else for open session? Yes, please.
So I have the unfortunate duty to announce my resignation from this board. There's been a change in my life circumstances that will create a conflict of interest, and I am no longer permitted to serve. And so this will be my last meeting. I'm very sad to be leaving you all. I've really enjoyed being a part of this group. You're all really wonderful people. You give so much to our community, so thank you. And still be around, of course, but it's been an honor to serve with you. So thank you.
Thank you. Thank you. Thank you.
Absolutely, Charles.
Absolutely. And remember what I said, Dick, we're open meetings and we expect to see you. I expect to look out there and go, oh, hey, what's going on, Joel? So don't you think that you're off the hook?
All right.
All right, cool. Anything else for open session? No? All right. We adjourn.
Thanks, everybody. Can we get a picture? Let me get the mic.
I know.